Sheila Marie de la Cruz from BSN 2B. In this return demonstration, I will be doing the pelvic examination. A few reminders before the procedure. First, check the doctor's order. Then, perform hand hygiene or hand washing. Then, provide privacy and comfort to the client. Introduce yourself to the patient. Then identify the patient by the two identifiers. You may ask the patient for her name and birthday for confirmation. Hi ma'am, I am Sheila Marie de la Cruz, your nursing assistant for today. Will you please state your name and birthday for confirmation? Okay, thank you, Ms. Santos. Lastly, explain the procedure to the patient. So, for today, we will be doing a pelvic examination. We're going to examine your pelvic area to look for signs of infections and etc. Is that okay with you? Okay, thank you. Now, before the procedure, gather all the materials needed, making sure that they are within easy reach. Next, ask the patient to pee or go to the bathroom to empty her bladder before the procedure. Then instruct the patient to lie on her back or assist the patient to a dorsal lithotomy position. Then properly drape the patient, exposing only the pelvic area. Now, let me assist you to be in a dorsal lithotomy position. Drape you to expose only the pelvic area. So now, I will be doing the perennial exam. So I already wear a clean pair of gloves. Also, I have a good examination light. Now with the glove hand, separate the labia majora, then inspect the labia minora, clitoris, urethral orifice, and the vaginal orifice. In this examination, we are looking for the signs of irritation, inflammation, redness, rashes, or genital warts. Then, we're going to note every information. So, as you can see, there's no presence of inflammation or redness on the patient's perineal area. Now, the next examination is the speculum exam. We will be using a speculum. I already washed the speculum with warm water and the temperature is okay for the patient. Now, let me lubricate the speculum. Hold the speculum between your index and middle finger. Then place your non-dominant hand on the introitus to separate the labia. Introduce the closed speculum, pass your fingers at 45-degree angle downward posteriorly. Blade should be held obliquely for an 8 o'clock and slight pressure exerted towards the posterior vaginal wall. Be careful not to pull the pubic hair nor pinch the labia with the speculum. Then, after inserting the speculum, rotate it horizontally, maintaining the pressure. Then, after that, open the speculum. Then, after that, inspect the cervix. Then, inspect the vaginal mucosa by gently rotating the blades of the speculum in both directions. After that, loosen the screws and slowly withdraw the speculum. The next examination is the internal exam. First is we're going to lubricate the middle and index fingers of my right hand. Then after that, insert the lubricated index and middle fingers of the gloved right hand and palpate the vaginal walls. Examine also the fornices, which are above and below the cervix. Also examine the cervix. Then after that, withdraw the fingers from the vagina. Now for the last examination, which is the bimanual exam. Before doing this procedure, make sure to maintain eye contact with the client as the exam is performed. Then separate the labia with the two fingers. Then gently introduce the lubricated index and middle finger of your gloved hand with palm upward into the introitus. Gently palpate the urethra against the symphysis pubis. Exert light upward and outward pressure. Also examine the Bartholin's gland between the thumb and two vaginal fingers. Do it on both sides. Then again, using the two fingers of the gloved hand and thumb abducted from your palm, identify the cervix. So after identifying the cervix, palpate the uterus by placing both examining fingers of the interior fornix above the cervix and sweep hand forward over the abdomen, pulling the uterus forward between the hands as possible. Also palpate the right fornix and the other hand in the area of the right iliac fossa. Bring the hands together and move them centrally toward the pubic bone. Repeat the procedure onto the left side. After that, withdraw your fingers from the vagina and ask the client to return to sitting position. So that's it for the pelvic examination. Thank you for watching.